Via. I'm the clinic director and nurse practitioner for Game Day Men's Health Lawrence. We're a men's health clinic based out of Lawrence, Kansas, and we specialize in testosterone replacement therapy, erectile dysfunction treatment, medications for weight loss, vitamins and peptides, and today I'm going to be instructing you on how to give your testosterone injection to yourself. Testosterone replacement therapy is given via an intramuscular injection. Intramuscular or IM injections mean that the medication is going directly into the muscle. There are 3 different sites that intramuscular injections are administered. They are administered into the deltoid muscle of the shoulder, the vastus lateralis muscle of the thigh, and then the gluteus maximus muscle of the buttocks. The glute is the most common location for TRT injections because testosterone itself is a pretty thick liquid. This can lead to soreness in the muscle for 1 to 2 days. Your medication and injection supplies will come in a box, kind of like this one, approximately 1 to 2 weeks after your prescription order has been placed. When you open your box, you're gonna find multiple different baggies with the supplies that we've ordered for you inside them. On each of the baggies is a label that tells you exactly what's inside the baggie and what it's used for. When you open your box, first you're gonna find alcohol swabs. The alcohol swabs are used to clean the top of the medication vial. They're also used to clean the skin above where you plan to inject. Next in your box, you're going to find Luer lock syringes. Syringes are used to draw up the medication as well as inject the medication. Luer lock just means that you're connecting the needle to the syringe in a twisting motion. There are various different sizes of syringes, and yours is going to be dependent on the dose that you're supposed to give yourself per injection. So if your injection dose is 100 milligrams or less, or 0.5 mils, you're probably going to receive a 1 mil syringe. If it's anything more, you're probably going to receive a 3 mil syringe. Next in your box, you're going to find 2 different types of 1-inch needles. An 18 gauge needle that's pink and a 23 gauge needle that's blue. Gauge is a fancy term for needles that relates to the thickness of the needle, and the smaller the number, the bigger the gauge. The 18 gauge pink needle is thicker. This needle is used to draw the medication from the vial and into the syringe. The 23 gauge needle is thinner, and this is the needle that you're going to attach to your syringe to actually inject your medication. If you ever have an issue remembering which needle to use when, you can always look at the directions that are on the label of the packaging. It tells you exactly when to use it. Or you can be a gentleman and think ladies first. Pink before blue. Next in your box, you'll find your testosterone. Your testosterone comes in a pill bottle, kind of like this one. On the pill bottle container, there is a label, and on that label, it tells you your prescribed dose, exactly how much to inject and how often to inject it. This patient's dose is 80 milligrams, meaning that they're going to inject 0.4 mils and they're going to inject it twice a week. Inside of the pill bottle is your testosterone vial. Lastly, in your box, you'll find your sharps container. This is where you're going to dispose of your syringes and your needles after you inject. To prepare for your injection, wash your hands with soap and warm water. Next, you'll need to gather all of your supplies for a singular injection. For one injection, you're going to need 2 alcohol preps, a syringe, a pink needle, a blue needle, your testosterone, and your sharps container. First, you're going to take an alcohol prep, and you're going to use it to wipe the top of the vial. If there's a cap on top of your vial, just pop it off. Next, open the package that has your syringe in it. Next, we're going to attach our first needle. And remember, ladies first, pink before blue. I open the package with the pink needle. And these are Lorolock syringe. So I just need to take the needle and the syringe and twist them together. Next, we're going to draw air into the syringe by pulling the plunger to the exact dose that we're prescribed. This patient's dose is 80 milligrams, which is 0.4 mils. So I'm going to draw air into the syringe until I hit 0.4 mils. Then I'm going to take the syringe and I'm going to take the needle and I'm going to go straight into the vial. Next, I'm going to push the air that's in the syringe into the vial. Then I'm going to flip the vial and the syringe upside down. Right now, the tip of my needle is past the medication and into the air into the vial. If I were to pull the plunger back now, I would just draw back air. So very carefully, I'm going to pull the needle and the syringe down until I can see that they are below the line or the level of the medication so that it's firmly in the medication. Next, I'm going to take my syringe and my plunger and I'm going to pull it down slowly until I hit 0.4 mils. If you notice any air bubbles in your medication or in the syringe, you're going to need to get those out. To do that, I'm going to push the medication back into the vial. Once that air bubble has fully returned to the vial, I'm going to pull this back down to my prescribed dose of 0.4 mils. And then I can flip this back over. I can take the syringe out and I can very carefully recap my needle. Now again, this needle is pretty thick. If I were to inject myself with this needle, it would hurt and I would probably bleed. So I don't want that to happen, so I'm gonna change out the needle. I'm gonna make sure my sharps container case is open. I'm going to open my blue 23 gauge needle to inject with. I'm going to firmly grasp the needle and the syringe, and this is a Lorolock, so I just need to twist for the needle to come off. I'm going to dispose of the needle into my sharps container, and then I'm going to take the blue needle, the skinnier needle, the nicer needle, and I'm going to put it onto my syringe and twist it on. Next, we're going to prepare our site for injection. To do this, we're going to imagine the glute spread into 4 quadrants. So a line going top to bottom and a line going left to right. Your injection site is going to be the top outer quadrant of that square. So on the right glute, it's going to be the outer right top quadrant. And then on the left side, it's going to be the outer left top quadrant. To make this site easier to access for self-injections, you can prop the bottom of the glute on a table or a countertop, and that pushes the glute upward and creates a little pocket that's perfect for injecting. With an alcohol prep, you're going to wipe the site for injection and allow it to dry. To give yourself the injection, remove the cap from the blue needle. Take the needle and point it directly at the skin where you want to inject. With a firm and smooth motion, insert the needle into your skin and into your muscle. Once your skin meets the blue part of the needle, you can move your hand so that your thumb is on the syringe. You're going to apply gentle pressure to push that medication out of the syringe and into your body. Testosterone is a pretty thick liquid, so if you need any resistance, that's normal. Once all of the medication has been injected and once the plunger has been fully depressed, hold it there for 3 seconds to make sure all the medication has been injected. and then you're going to remove the needle in a smooth and steady motion. After you pull the needle out, you can take the syringe and the needle and throw it into your sharps container box. If you notice any bleeding, you can use one of the alcohol preps to apply pressure. Make sure to keep your injection supplies, your medication, and your sharps container out of reach of children. Make sure to keep the vial of testosterone in the child-proof container and to keep your sharps container closed. The medication is just stored at room temperature. And if the cap is off of it, you don't need to recap it. Now you have successfully given yourself an intramuscular injection, and you're on your way to looking and feeling your best. Thank you for choosing Game Day Men's Health and trusting us with your care. If you ever want to support the clinic, the best way to say thank you is to refer us to a friend or leave us a review on Google. Happy injecting.